So today we're going to be talking about the Y90 procedure, and I'm going to explain what it is and how it's done. So Y90 stands for yttrium-90, which is a radioisotope. A radioisotope is just a fancy name for a radioactive material. In this case, it comes in form of little grains of sand that come in a little vial that can be injected through a catheter directly into a tumor. So why is this procedure getting so much attention? Why is it so useful? And who are the patients who are candidates for this procedure? Let's say if you've been diagnosed with a cancer that is limited to the liver. It could be a tumor that started in the liver, such as a hepatocellular carcinoma or a cholangiocarcinoma. I know those are fancy names, but you may know about them. Or could have been a tumor that started somewhere outside of the liver, for example, in the breast or in the colon, and migrated to the liver or led to liver metastasis. And the tumor may be treated elsewhere, but it's still alive in the liver, so we still have to deal with that. We certainly always consider surgically removing them, which involves either an incision or a big operation that can lead to a long recovery time. But some patients may not be candidates to surgery because they are too sick, or because their anatomy is difficult, or simply because they don't want to go through a big surgery. Well, we all know chemotherapy is effective, but most of the time chemotherapy is very good in killing the tumor temporarily, but if you stop it, it may come back. That's where Y90 comes in. And like I said, it can be used for both tumors that are rising in the liver or tumor metastasis to the liver. And the way the procedure is done is with what's called an angiogram, and that's when we insert a little tube in an artery, either in your arm or in the groin, and we snake this tube. It's a very small tube that we snake through the arteries in your body, guided by X-rays, and we can navigate through the hepatic artery all the way into the liver and actually find the little branch that is going to this tumor. Once we find it, we then inject contrast to confirm the position, and then we park our catheter there, and we can inject the Y90 through the catheter that will be deposited all over the tumor. Another name for this is brachytherapy, which you may or may not be familiar. When this Y90 gets deposited here, all these little spheres will emit a radiation called a beta radiation. And what is interesting about the beta radiation is it is very effective in killing the tissue around it, but it only travels 1 to 2 millimeters. So it will spare any of the other organs around, including your healthy liver. So this will not only make the procedure safer, but will make your recovery time a lot easier. If we decide you are a candidate, the first thing we do is we perform a mapping procedure. And that's more or less like a dry run. We do the procedure exactly the same way we would do to treat the tumor, but we actually can map which specific blood vessels are actually going to the tumor. And to do that, we do extensive imaging, including some fancy CT type of imagings that we do during the procedure while the catheter is still inside your liver. We also inject a test dose of radiation because we want to know not only the volume of tissue that we're treating, but also we want to know where is the radiation going. And we also want to make sure not much radiation is going to other organs like the lungs, for example. After we inject this test dose, we actually take you to the radiology department. We take a picture of your entire body so we can measure where the radiation goes. After we're finishing with the mapping, we can schedule the treatment procedure in 1 to 2 weeks. And the treatment procedure is actually easier because we know exactly what we're doing. So again, we do the procedure either to the wrist, but most commonly to the groin. You'll have to rest for 2 hours after the procedure in the recovery room, and then you will go home in the same day. Most patients will feel good in the first day or two after the procedure, but then once the radiation kicks in, the patients will become tired. In general, the patients recover in 1 to 2 weeks after the procedure, and they can go back to their normal life. These are minimally invasive insights with Dr. Fabio Komlos, and I see you next time.